Welcome back to HPHA's Pre-Admission Patient Education for Hip Replacement Surgery, Module 4, After Surgery and Beyond. In this section, you will learn about everyday activity guidelines, physiotherapy after hospital, transportation, wound care, complications, other activities, returning to work, long-term care of your hip, and resources. Don't forget, you can follow along on the pages 26 to 40 of your booklet. Doing the exercise assigned by your physiotherapist will help you move your new joint and enjoy greater independence. At home, continue the 6 exercises you were doing in the hospital 3 times a day. Don't forget, you can find those exercises on page 24 of your booklet. The hospital physiotherapist will confirm that you have arranged your physiotherapy appointment for when you get home. Your community physiotherapist will teach you exercises to stretch and strengthen your legs and improve your walking and balance. As you recover, these exercises will change. Talk to your community physiotherapist if you have any questions about your exercises or concerns about your progress. Driving is not allowed after hip surgery for the first 6 weeks, regardless of which hip was operated on. After hip surgery, it can be challenging getting into and out of the vehicles. Talk to your therapy staff if you have any questions about traveling in a vehicle. Here's a quick video on how to get into and out of vehicles. You can also follow the instructions on page 32 of your booklet.
All right, so we're going to talk about how to get in and out of a car. If you're getting into a low car, you're going to want to make sure that the car is parked away from the curb if there's not a sloped entryway. If you're getting into a higher vehicle like a van or an SUV, you can park up right beside the curb because then that helps just get up into a higher vehicle. If you're getting into a low vehicle and the back of the seat is lower than the front of the seat, you might want to consider a wedge cushion just to help maintain the hip flexion angle. You're also going to want to make sure that the car seat is in the rearmost position and then the back angle of the seat is reclined as much as possible. From here, you can take the walker with you until you feel it behind your legs. Move the walker out of the way. You can grab a hold of the door with the window down, reach back for the seat, outstretch your operated leg, and slowly lower yourself into the vehicle. Recline your chest as much as you can. As you're turning into the vehicle, try and keep that outstretched leg as straight as possible and turn yourself into the car like that. To get out of the vehicle, it's the same in the reverse order. So turn yourself out, keep that leg as straight as possible, and recline your upper body. Bring yourself to the edge of the seat, outstretch that affected leg, and then you can push yourself up into standing, pushing up.
Despite the success of total joint replacement, there is a small risk of developing complications. Remember, getting out of bed and walking as soon as you are able will help prevent many of these complications and allow for a smooth recovery. You will find more information on possible complications following hip replacement surgery and how to prevent them on pages 34 to 36 of your booklet. If you develop any of the complications listed in your booklet, call your surgeon's office and tell them what you're experiencing. If you are unable to contact your surgeon, go to the nearest emergency department. Call 911 immediately if you have shortness of breath, sudden chest pain, coughing up blood, or your surgical leg is suddenly extremely painful, shortened, and/or the hip cannot be moved. You'll find more information on page 37 of your booklet. You'll learn about air travel, grooming, sexual activity after hip replacement. When you return to work depends mainly on what type of duties you must perform. Most patients do not return to work until at least 6 to 8 weeks after their hip has been replaced. Talk to your surgeon before planning on returning to work. Remind your dentist that you have had joint replacement surgery before having any dental work done. Some activities such as running and contact sports are not recommended after you've had a hip replacement. If you have any questions or concerns, please speak to your surgeon. Module 4 Summary. Once you are discharged from the hospital, there are many things you will need to do while you recover. Perform your exercises as directed by your physiotherapist. Remember your hip precautions. Keep your pain or discomfort under control. Take care of your incision and dressing. Watch for and try to prevent potential complications and call your surgeon's office if you think that something may be wrong. Keep all of your follow-up appointments with your physiotherapy and your surgeon. The information booklet that you have been given has much more information than has been presented today. Please take time to read through the booklet and remember to bring it with you to the hospital. If you have any questions, write them in the booklet so you remember to ask them during your hospital stay. We hope you found the information in this module and booklet useful. We wish you a speedy recovery and many happy active years with your new joint.